Candidates, how would you put Medicare on stronger financial ground and protect today's seniors and future retirees from the burden of rising health costs?
I appreciate that question. It's important. Do we have any people in here that are 55 years or older? Anybody that care to say, not admitting that you're 55 or older? The bill that we passed through the House of Representatives, for you, with Medicare, nothing changes. Nothing changes. We're standing up for our seniors. I made a pledge when I ran for office 2 years ago. Make sure that we stood up for our senior citizens. Every vote has reflected that commitment. But every senior citizen I know also cares for their children and their grandchildren. These aren't my numbers, they're the President's numbers. 2024, Medicare goes bankrupt. We've heard no plan from Mr. Pace in terms of how are you going to make Medicare sustainable. We need it for his generation so that we can make that promise fulfilled to them. They're going to call it a voucher. He's already writing it down. It's not a voucher. If you have that choice, you can stay on Medicare, or you're going to have menu of choices. Much like Medicare Part D, which is very popular with many senior citizens right now. Be able to make sure that you're driving those costs down. And we need to make sure that we're having real competition as well. We need to repeal, again, Obamacare in this country, which is driving up costs, hurting jobs, it is bankrupting the Medicare system, it is inflaming the Medicaid system in this country. We have better proposals that are out there to allow competition to work, to incentivize private medical health care savings accounts, to make sure that if you're a small business, you can actually come together, be able to negotiate even better rates as well.
I think it's great to have a debate, but one thing we should all agree on is that we base it on facts. If you're older than 55, the donut hole comes back immediately for you, meaning that more prescription drugs cost more money under the Tipton-Ryan budget. In addition, it is a voucher. Senior citizens will have to go onto the private marketplace and purchase private insurance. This is the first, we've been running for a year against each other, and this is the first time Congressman Tipton has said it's not a voucher. If it wasn't a voucher, I'm sure I would have heard it a long time ago from Congressman Tipton. My dad's back there. He's 74. I was in the hospital with him when the doctors were pounding on his chest to revive him a couple years ago. He's on his third pacemaker, and there's absolutely no way living on Social Security as a retired mechanic that he could go into the private marketplace and purchase insurance because of his pre-existing conditions. And a lot of seniors have a lot of pre-existing conditions. The truth of the Tipton-Ryan budget is seniors, and this is from the nonpartisan Congressional Budget Office, seniors will have to pay $6,400 out of pocket to have the same type of care that they already have today. I think it's important that we address the real issues. We have to look at the fee-for-service model. We have to look at the parts of Obamacare that we agree on. We have to work together. But Congressman Tipton, 33 votes in 2 years to repeal Obamacare. When did you expect a different result after vote 15, 20, 30? The fact is you didn't expect a different result. It's just more partisanship out of Washington that we're all sick and tired of.